users and friends. Thanks so much for joining me today. I'm Carla, the Director of User Engagement at NeedyMeds, and today we're going to talk about Dr. Richard Sagal's 7 Secrets to Save on Medications. First, I'll offer a few tips so you can make the most out of the presentation. You can ask questions by any time by typing them into that questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get the chance to answer your question, we will follow up with you by email. Of course, I will provide my contact information and the contact information for NeedyMeds at the end. This webinar is being recorded and will be posted on our YouTube channel. And you can find my PowerPoint slide deck and other materials I thought you'd be interested in that handout section of your control panel. With this presentation, I'm going to cover what NeedyMeds is. We'll talk about the healthcare savings resources we offer. We'll get into those 7 secrets for medication savings put together by Dr. Sagal. And of course, I'll offer some easy ways to stay in touch with NeedyMeds and up to date on healthcare topics. So let's get started with what is NeedyMeds. We are a national nonprofit co-founded more than 2 decades ago by a retired family physician, Dr. Richard Sagal, and his friend Libby Overly, who was a medical social worker. Here's our mission statement, but simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And to find healthcare cost savings resources, you simply go to needymeds.org and click on that Healthcare Savings tab, where a whole bunch of categories will pop up, which are all different ways that you can save on your medications and other healthcare costs, including right at the top on the left-hand box, our patient assistance programs and our $4 generic drug discount programs. You'll find our category for free, low-cost, and sliding scale clinics for medical, dental, mental health, and substance abuse clinics. You can find a section for retreats, coupons, rebates, and more. I got ahead of myself there. And the top middle, you can find diagnosis-based assistance programs. Right underneath that, you'll find our COVID-19 Resource Center. If you're looking for help with medical transportation costs, you can find that in the category titled Assistance with Medical Transportation Costs. We also have retreats, camps, recreational programs, and educational scholarships for those living or caring for someone with a particular diagnosis. You can find government programs listed by state, and of course a link to the NeedyMeds drug discount card. You may already be aware of all of our resources and other common ways to save on medications and healthcare costs, like shopping around for the best price, switching to generics, and splitting pills. Today, we're going to showcase other ways to save you may not have seen before with Dr. Rich Sagal's 7 Secrets to Medication Savings. Rich, again the co-founder of NeedyMeds, put these tips together himself to share with NeedyMeds users. Now, some of these tips may be a little complex, but they may be helpful if other methods have failed. And they may also, along the way, give you a better understanding of the treatments and the medications you're taking. So let's dive in, first of all, with checking to see whether or not you're treating the symptom or treating the cause. So when you're sick, you want one thing, to feel better. And your healthcare provider may give you a symptomatic treatment. For example, a medication that lessens your symptoms. Examples include an antihistamine or decongestant, which may help with the runny or congested nose of a cold. An anti-diarrhea medication may help with the runs associated with the stomach bug. Or something like an anti-itch medicine, which can help with being uncomfortable with a rash or an insect bite. While all of these treatments may make you feel a little better, they do nothing to help to speed up the healing process and may actually delay healing. But they certainly can help to empty your wallet. Basically, these symptomatic treatments are optional. It's up to you whether you want to spend the money on them or not. So, the second secret that we're going to move right into is decide whether or not you really need that medication. It's important to remember that not every medical problem needs to be treated. The body has remarkable healing powers. Daily, we are exposed to all sorts of germs, most of which the body deals with just fine. Many aches and pains are the result of normal activities and don't need any treatment except ice, heat, or rest. One common example is lower back pain. Around 80% of adults experience it at one time or another, and at any moment, 15 to 20% of adults 45 to 64 have back pain. According to the Cleveland Clinic, 60% of back pain sufferers recover in 1 to 3 weeks, 90% in 6 to 8 weeks, and 95% in 12 weeks. The treatment received or no medical treatment makes no difference. In fact, less than 1% of back pain has a serious and treatable cause. Most minor respiratory problems, stomach problems, sore throats, and other self-limiting illnesses don't need any treatment by a healthcare provider. It's rare for a person experiencing self-limiting and self-resolving symptoms to be affected with a serious illness. You may do just as well without any treatment. Let's move on to secret number 3, polypharmacy and deprescribing. Polypharmacy is the use of many drugs. The definition of many depends on who's defining the term, but the cutoff is generally 5 or 6 drugs. There are many causes of polypharmacy. These include treating multiple diagnoses at the same time, taking drugs not prescribed for you, excessive use of over-the-counter drugs or supplements, multiple prescribers caring for you with no one prescriber overseeing the medications, and the lack of stopping no longer needed drugs or ineffective drugs. Now, deprescribing is kind of the opposite of polypharmacy. It's the stopping of no longer needed medications. The process of deprescribing involves evaluating each drug, asking if it is helping to keep you happy and healthy, or if it's no longer needed. Examples of unnecessary drugs include drugs used to treat a now resolved issue, an ineffective drug that was never stopped, or a drug used to treat a now resolved side effect of a drug. While polypharmacy will increase your medication costs, proper deprescribing offers the opportunity to lower your medication costs by eliminating unnecessary medications. Added benefits of deprescribing include reducing the risk of side effects and potentially serious drug interactions. Secret number 4 focuses on combination drugs. While most medicines contain a single active ingredient, there are some that contain 2 drugs that are used in combination to treat a specific ailment. For example, some creams or ointments for skin conditions may contain a steroid plus another active ingredient. There are also blood pressure medications that contain a diuretic plus another blood pressure drug. The advantage of combining drugs is better compliance because you only need to take 1 pill rather than 2, or you only have to apply 1 cream or ointment instead of 2. The disadvantage is that sometimes you have to pay for this inconvenience because the cost of the combination product may be greater than what you would pay if you bought each drug separately. Always check to see what's cheaper, the combination medicine or buying each drug separately. Sometimes the combination is cheaper, but often it's not. The difference is what you pay for, convenience. Let's move on to secret number 5, which is over-the-counters versus prescriptions. Rarely, the Food and Drug Administration is regularly, the Food and Drug Administration is approving over-the-counter versions of medications that formerly were available only by prescription. For example, look at all the non-steroidal anti-inflammatory drugs and acid suppressors. All used to be available only by prescription, but not any longer. There are two differences between the over-the-counter and prescription versions. One is the dosage. The over-the-counter or OTC drugs usually contain around half as much active ingredient as the prescription version. OTC ibuprofen pills, for example, contain 200 milligrams of the active ingredient, while the prescription version contains 400, 600, or 800 milligrams. The second difference is often the price. Now, often, but not always, the over-the-counter is cheaper than the prescription version, milligram for milligram, but this isn't always the case. With most of these drugs being a tier 1 drug in insurance plans, the copayment may make the prescription version cheaper than the OTC version. It makes sense to check and see. Another reason to consider a prescription version of the drug also available over the counter is that your insurance may pay for the prescription version, but not the over the counter version. So let's talk about secret number 6, which is supplements. In this category, we include most vitamins, herbal supplements, weight loss pills, immune boosting products, muscle building supplements, etc. They are considered dietary supplements and have not been evaluated by the FDA for safety or efficacy. According to FDA regulations, they should contain the warning, these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Another way to put it is these products are assumed safe until proven otherwise. Assumed safe should not be confused with being safe. Rather, it means we don't know if they're safe because they haven't tested them for safety. All too often, they turn out to be unsafe or not an effective treatment. In fact, supplements are one of the major causes of liver disease. They don't work and may interfere with your prescribed meds. The bottom line is, you shouldn't waste your money on them. Secret number 7, don't buy more than you need. There are many reasons why you may stop taking a medicine prescribed for you. It may not work, you may have side effects, or it may interfere with another medication you're taking. So you end up disposing of all of the untaken portions of the prescription. That's like throwing away money. When starting on a new medication, it's best to ask a pharmacist if it might interact with any other drug you're taking. In many cases, you can get less than the number of pills prescribed to give the medication a trial. If the medication causes no problem and it's effective, then you have the rest of the prescription filled. You can also ask the prescriber if samples are available. If so, you might be able to get a week or so of free medicine to try before you spend any money. And when buying over-the-counter meds, you shouldn't buy more than you need. The price per pill is less when you buy a larger bottle of pills, but the saving is lost if you only take a few and the rest go unused until they expire. So those are Dr. Sagel's 7 secrets to medication savings. That's his list of ways you can control your healthcare costs and in some ways your health. Although some may be difficult, all are achievable. And the added benefit to saving money is living a longer and healthier life. But we're actually not done yet. Rich also wanted to add 2 bonus ideas. The first bonus idea is clinical trials. The FDA puts all new drugs through an intensive testing process before they're approved. Although initial phases of this process start with testing on lab animals, the later phases involve testing on humans. People enrolled in these studies receive free medical care, medications, and follow-up. Depending on the study, participants may receive new drugs with the potential of improved treatment. All these studies must be approved by the FDA and by at least one institutional review board. This protects the participants and ensures that testing protocols are ethical. And you can find out about all these studies on www.clinicaltrials.gov. The second bonus idea is lifestyle changes. The best way to save on medication costs is to do your best to stay healthy and not need meds. According to the book Exposing 20 Medical Myths, about 40% of our life expectancy is determined by things we do or things done to us, like smoking, drinking, doing drugs, being obese, or being a victim of violence or accidents. Another 30% is due to our genetics. Social circumstances, such as living in wealth or poverty, determine 15% of a life expectancy. And environmental exposures, whether or not you live around lots of pollution, account for another 5%. That leaves 10% to medical care, but that 10% can be more expensive than the cost of the other 90%. The best way to control the cost of this 10% is to control the things we can control, the lifestyle choices that are detrimental to our health. Lifestyle changes such as quitting or not smoking, regular exercise, good eating habits, and getting enough rest may not be easy, but they're not costly. Lifestyle changes are the first step in treating adults with diabetes or high blood pressure, for example. For some patients, weight loss and diet, along with smoking cessation and increased exercise, are all that's needed to control these conditions. Lifestyle changes are cheap and may even put extra money in your pocket. We do hope you found these tips useful. If you'd like to share them with others, we will convert this presentation into a video and post it on our YouTube channel. I suggest subscribing so you won't ever miss out on our videos, presentations, or webinars. It's a great way to keep in touch. And while we're talking about that, let's move right into talking about other ways you can stay in touch with us. On the top right of our homepage, you'll see a bunch of social media icons. That's where you can find, for example, our YouTube channel. You can find links to our Facebook, Twitter, Instagram, and Pinterest accounts so you can follow us. Needy Meds is also on LinkedIn. You will also find a link to the Needy Meds blog called The Voice, where you can read timely, provocative pieces on healthcare-related topics. And underneath these icons, you will find the navigation tab. On the very far left, you'll find that healthcare savings tab, where you go if you are looking for healthcare savings resources. And next to that, you will find the education tab. And that's where you will find our subscription center, where you can order print materials such as our drug discount cards and brochures and sign up for email alerts about program changes. Under that education tab, you can also check out and sign up for other upcoming webinars. You can sign up to receive our monthly e-newsletter, Vitals, and learn about becoming a Needy Meds volunteer ambassador. So, as I mentioned in the beginning, I do see some questions coming in. You can type them to me in that questions section of your GoToWebinar control panel. And as we get to those questions coming in, I want to leave up our contact information. If you're interested in ordering a bulk supply of drug discount cards and brochures, reach out to my friend and colleague Alana at alana@needymeds.org. If you have any questions regarding this webinar or the content covered, shoot me an email at carla@needymeds.org. We do hope you check out our website, needymeds.org, to further familiarize yourself with the healthcare cost savings and educational resources we have to offer. And don't hesitate to reach out to our toll-free helpline, 1-800-503-6897. Our expert counselors are available weekdays, 9 a.m. to 5 p.m. Eastern Time, and we do have Spanish-speaking counselors as well. So let's get to those questions coming in. Is there a fee for Needy Meds? So, great question. We are hoping you reach out to us first if you're having trouble with your healthcare costs, because not only is there no fee to visit our website or call our helpline for assistance, but it's also anonymous. That means we do not collect your personal data to either connect you to a program that will help you save on or afford your healthcare expenses, or to provide you with the drug discount card. So no, there is absolutely no fees to get assistance through Needy Meds. Another question coming in. What is the website for clinical trials? Okay, so we're talking about, I mentioned a few slides ago, one of Dr. Sagel's bonus suggestions about saving money was to check out, first of all, was lifestyle changes, but the other one was to find out or learn more about enrolling in clinical trials. The website for that is www.clinicaltrials.gov. Again, that's clinicaltrials.gov. People enrolled in these studies receive free medical care, medications, and often follow up. Depending on the study, participants may receive new drugs with the potential of improved treatment. Again, all of these studies must be approved by the FDA and at least one institutional review board. This protects the participants and ensures that testing protocols are ethical. So, another question coming in: how can I get a Needy Meds drug discount card? Oh, thanks for that question, because the Needy Meds drug discount card is a great way to save on your medications and healthcare costs. So on needymeds.org, on the left-hand side, you will see a box with a red arrow that reads Get Your Drug Discount Card. That will take you to our drug discount card page, which explains how to download our free drug discount card app, request a card be mailed to you, or even print out a card. You can always give our call center a call at that number on the screen, 1-800-503-6897, to request a drug discount card be mailed to you. And again, if you are looking to receive a bulk supply of those drug discount cards, you can drop an email to me, Carla at needymeds.org, or Alana at needymeds.org. So I'm going to go ahead and wrap it up with those questions because I do like to keep the question segment brief. But as I said in the beginning, if you did ask a question and I didn't get a chance to answer it, don't hesitate to check out our website, reach out to one of our call centers, but of course, we will follow up with you via email as well as soon as we can. For now, thanks so much for your time, and we do hope you stay in touch.